I'm Dr. Sreenivasa Murthy TM. Can tonsils go away naturally? I mean, it's a very naive question. What can actually happen is it can undergo what is called as atrophy. That means over a period of multiple years, if the tonsil has never got infected, it has never been put to use or test by the person's nature, then it can slowly become smaller in size and become atrophic. But it never disappears. It will always be there. A simple way of assessing this question is since 1950s we have allopathy medicine bringing in antibiotics. Prior to 1950s, by and large, all over the world, treatments were based on local medication, herbal medication, those kind of things. So wouldn't people survive tonsil infections then? Yes, that is because of natural healing. But then they would also have to bear with so much of pain, discomfort, unexpected turn of events. Now, a very interesting clip of history says there was a school of thought that the first president of the United States of America, he probably died because of a tonsil infection. Now, that means he probably had a condition called what is called as quinsy, wherein after he had a tonsil infection, there was pus formation which got accumulated between the tonsil and the throat wall, and from there the pus can actually spread into various different directions and then cause widespread infection. And then obviously those days antibiotics and other things were not available, people would succumb. Now today's world, thankfully we are not in such a situation, we don't need to experiment with all those things. So if somebody has a throat pain, some soreness in the throat, you don't need to rush to the doctor on the very first day. You can manage at home by doing gargles, warm saline gargles, maybe some iodine-based products you can use to gargle. You can take warm diet, liquid diet. You can use certain over-the-counter medication like paracetamol for relief of pain and fever. And you can wait for about 48 hours. But in 48 hours, if you are not finding yourself to be improving, then it is always worthwhile that a doctor sees, because it can be a situation where you might be having a bacterial infection, you might need a course of antibiotics that you probably will not be able to do it on your own at home. Why do people get a tonsil infection? It is largely because of what they eat. So tonsils are at the back of the throat. So what we eat actually goes along the oral cavity. They touch the tonsil and then go inside into the food pipe. So which are the foods which can lead to secondary infections? Now food which can cause secondary infections are basically uncooked, uncleaned food. So to give a very simple example, anything which is refrigerated, very cold, taken off the fridge and had, is usually uncooked. So they can harbor bacteria or germs which can cause infection in the tonsil. So similarly, when we eat food from outside, like food which are handled by food handlers whose hygiene may be suspect, in such situations you can have infection. Chutney can be a big source of infection because chutney is uncooked food. Salads can be uncooked food. Juices can be uncooked food. Sometimes ice creams, if not kept in a well-controlled temperature refrigerator, can harbor bacteria and then cause infections. So these tend to happen more in children and adolescents rather than adults. By the time we are in our late teens and early 20s, our body would have got exposed to most of the common organisms for which we will have developed some amount of innate immunity, and we know our body can fight it out. But if our food habits are suspect, our oral hygiene is very bad, then repeated infections can occur because of our hygiene factor. Now, the other thing that can happen in an adult with repeated sore throat is they may be harboring infection in a hidden area in the head and neck called the sinuses. So if you are having a condition called as chronic sinusitis or even subclinical sinusitis, then you may be getting repeated sore throats. So an adult, if they come with repeated tonsil infection, it is always worthwhile to rule out whether any such hidden infections are there or not. So what are the causes of tonsil stones? Here there are two aspects. We can develop stones within the tonsil. It is called tonsillolith. This is not something which a common layman would encounter. What a common layman encounters and he thinks it is tonsil stone is when he sees in the oral cavity, he sees in the mirror, he will see some white spots on the tonsils. So he thinks it is either pus, or when he has gone and met a doctor, doctor might have told it is tonsil stones. Now this is called keratosis tonsil. Now keratosis tonsil tends to happen because of accumulation of food debris along with the epithelium, that means the covering, the lining of the tonsils, getting into a structure called as a crypt within the tonsil. Now, tonsil is not a round structure like this, it has gaps in between, and there is a small crevice inside that is called as a crypt. Now, when these food particles, debris and epithelium tend to get accumulated within the crypt for a long duration, the outer part will be visible like a whitish, off-white, creamish color patch on the tonsil. Now, this can cause bad breath. It can also cause very rarely secondary infection. How do we prevent this? Again, oral hygiene. You will have to gargle your throat after every meal. These keratosis tonsil can actually be removed by pressure. So, digital pressure. Some people use their fingers to press on the tonsil and it can come out. If you go visit a doctor, doctor also will use a spatula. He or she will put pressure on the crypt and then everything comes out, and after that maintenance of oral hygiene is what will help. So, does this need removal of the tonsil? This is not an indication for tonsillectomy, but then again, if it is causing bad breath, repeated infections, then as a relative indication we may suggest a tonsillectomy for an occasional patient.